The WHO storage in Antananarivo, the capital of Madagascar. Medicines, personal protective equipment, disinfection equipment, all against the plague epidemic that currently rages in Madagascar. Everything stored here must be sent to 33 high-risk districts in the country, which should bring the number of districts in Madagascar that have received plague materials since the beginning of the epidemic to 41.
Nous sommes ici dans le magasin de médicaments.
We are here in the drugstore, equipment products that the WHO has offered to the Republic of Madagascar to fight against the epidemic of plague. There are medicines that can treat up to 5,000 patients and 100,000 contact persons of cases. As you know, not only do we take care of the patients, we treat them until complete healing, and those who have been also in contact with the sick or a person suffering from plague, we give them chemoprophylaxis so that they do not develop the disease. We can treat up to 100,000 contact persons with these drugs. We also have personal protective equipment for the prevention and control of the infection, which means we give these equipment to health providers in order to avoid contamination. For those who work with the sick or with people who died from plague or with their families, we give them this equipment, which consists of personal protective equipment as a disinfectant. We also have rat poison and insecticides.
The current epidemic of plague in Madagascar began in late August with a person infected in Ankezobi, in a center of the country, who died in a bush taxi in Moromanga in the east. On the way, he infected 2 passengers who died in Tamatave. Since then, the disease has spread to large urban centers of the country, and especially in Antananarivo, the capital. The authorities immediately increased the number of preventive measures: closure of the university and schools for disinfection, control at bus stations, and suspension of public meetings. Called upon by the states, the WHO, the World Health Organization, has delivered 1,200,000 doses of antibiotics capable of protecting up to 100,000 people, masks, and other products for disinfection. The UN agency and other partners also trained urgently hundreds of volunteers in charge of information and prevention among the population.
As
part of the lessons we have learned from the fight against the Ebola epidemic, we know that we must react in time and that the strength of our action lies in the earliest response. And in the context of the plague, I can tell you that as soon as there was the first reported case of pulmonary outbreak in the town of Tana, the whole system of the WHO African region was put into action. And that is how we started to trigger the response immediately. We have been on the field for more than 4 weeks, and as you know, since September 20th, exactly, the World Health Organization for the African region appointed an incident manager, that is to say, an operations officer who should be working with me. So we've learned from the Ebola, and we will not repeat the same mistakes. According to the latest report published by the Ministry of Health, 610 cases of plague and 63 deaths have already been recorded on the whole of the Big Island. That is to say, a fatality rate of less than 10%. Some 100 patients have been treated and some are still under treatment in health facilities.
Il y a des centres opérationnels.
There are operational centers, health surveillance centers, and security monitoring centers that have been set up to contain the epidemic. Initially, we focused on the effort to contain the epidemic while trying to attack the spread of this outbreak in the health sector. Presently, we have 5 districts that have not shown any new cases in the last 10 days or so. So we are focusing on the others who are much more active. I would say, like any epidemic, the slightest inattention can cause an outbreak, a peak that one cannot control, but I'm confident in the system set up now. Everyone is on alert, everyone is in action, and the system is on. And given the figures we have right now, I think we will have great results very soon.
On aura de bons résultats là-dessus.
In this small office of the Malagasy Ministry of Public Health, the telephone does not stop ringing. The operators of this temporary call center respond to calls on the toll-free number recently opened by the state. They advise, direct the possible cases of plague, and respond to the concerns of citizens who want to know more about the disease.
Ils veulent savoir comment exactement.
The main concern, most often, is that they want to know how exactly the symptoms of plague develop and how prevention is done, as well as the conduct to be taken in similar cases. There are also people who are asking about our role in the Department of Health in relation to plague. They sometimes ask for advice and guidance.
The response to the plague epidemic in Madagascar is rather reassuring. In fact, panic movements caused by the epidemic have declined. From now on, the populations are serene. They know through sensitization how to protect themselves from plague. Here in Anosi Avaratra, 10 kilometers north of the capital, Antananarivo, one of the sources of infection of the disease, doctors have made door-to-door actions.
I'm really not afraid, because we have received instructions from the doctors who have explained how the disease spreads, how to protect ourselves, and then we are next to a health facility where patients are taken care of every day, so there is no reason to succumb to panic. My daughter was vomiting blood. We took her straight to the hospital because we had already enough information about the plague, and the disease was curable. Today she has been cured.
Monday morning in Antananarivo, a new week begins with challenges for health personnel and the WHO team, including identification and follow-up of close contacts of patients with pulmonary plague and administering chemoprophylaxis for 7 days. The monetary team holds a coordination meeting prior to field operations. At the beginning of the week, the number of contacts to follow is 2,800 in all Madagascar, of which 2,410 in the capital. Ndihutepenek, a shanty town in the center of Antananarivo, hosts community agents in charge of monitoring and the WHO surveillance team which oversees the operations.
The result is truly the masterpiece of the fight against the disease. In order to break the transmission chain, teams must be able to detect all persons who have been exposed to a confirmed or probable case. Once these cases are detected, they can be treated under chemoprophylaxis and monitored for a period of 7 days. It is really the masterpiece that will allow us to break the chain of transmission.
The WHO here in Madagascar is supporting the Ministry of Health for the uploading of contacts, tracking data as part of the surveillance of this current plague epidemic. The application form we have developed in these tablets therefore allows at the central level to make in-depth analysis so that we can make informed decisions. Plague reappears almost every year in Madagascar, usually from September to April. But this year, the epidemic began in August and spread to large urban areas, unlike the previous ones. Since the declaration of the epidemic, the WHO Regional Office for Africa, the country office and headquarters provide direct technical and operational support to the country and work closely with partners to provide a rapid and effective response. A total of 1,800 community health workers were trained to strengthen early warning and surveillance, as well as 340 physicians and students trained as supervisors.
Le combat est loin d'être gagné, c'est vrai.
The fight is far from being won, but we will keep it on, and the biggest challenge is the mobility of the population, because we have cases of bubonic plague in all the districts of Madagascar, especially in some well-known areas, but also this time in the city of Antananarivo and in the city of Thomasen. We have cases of urban pulmonary plague, we have cases of bubonic pulmonary plague, and this has completely changed the way we deal with the epidemic.
Et ça a changé complètement dans notre façon de faire face à l'épidémie. Mais au départ, ça.
At the beginning, it also changed our tactics on how to deal with the epidemic. But right now, with the close cooperation we have with WHO, we have put in place all the necessary instruments and adequate measures to work effectively.
Pour qu'on travaille vraiment de façon efficace.
In addition, the joint intervention plan of the government of Madagascar and its partners has been adjusted to $9,500,000. To date, the WHO has provided $1.5 million and launched an appeal to the international community to mobilize the necessary funds, a call that already collects favorable answers.
Il y a des réponses. Nous avons certains pays.
There are answers, and we have some countries that have responded favorably. We have partners like Gavi who ask us to see how they will join the answer. We are very optimistic because the plague, everyone is aware that this is an unacceptable disease. It is sad to see someone die of plague. And I believe that today the international community is aware of this. And we're working hard to mobilize more resources, not to only put an end to this epidemic, but to engage in a dynamic of what we're going to set up here in Madagascar. Since October 8, 2017, the WHO and the Minister of Public Health of Madagascar have taken steps to prevent the international spread of plague. These measures include checking out passengers departing to the international airport by means of temperature control, maintenance and treatment for symptomatic passengers, and prophylactic antibiotics for passengers at risk. The WHO has also produced and shared with high-risk countries a draft guidance note on the requirements of the international health regulations concerning travel to support port of entry preparation activities, in particular airports and ports maritime.